Hi there, I'm Dr. Michael Lebowitz. I'm a researcher in applied kinesiology and been teaching it for many years. I'm also a quality control person and product developer for Supreme Nutrition. And this is Dr. Noah Lebowitz, who is very similar. And we're going to try to do these monthly. It's a little bit informal, but today we wanted to talk about GI issues. We have a lot of patients that have all kinds of things, anything from chronic diarrhea, chronic constipation, IBS, bloating, burping, Crohn's disease, just about any.
SIBO, celiac.
And so we wanted to share a little bit about maybe underlying causes and so forth. When we see people like this, the first thing we think about typically is some type of microbial imbalance. That can include H. pylori, it could include parasites, bacteria, viruses, fungi, and they can cause a myriad of symptoms. They can cause diarrhea, constipation, IBS, bloating, any of those type of things.
I mean, generally gut issues respond really well if you look at the two, I would say, main factors, and that's just balancing the gut microbiome. So depending on what someone has, if that's H. pylori or a different type of virus or bacteria or parasite or fungi, candida, any of those, if you balance the gut microbiome, that's one of the biggest things that you can do to get someone's gut, and typically they respond really well in the sense of killing off the bad stuff and allowing the good stuff to take over. It's very easy. And then also taking people off offending foods, not true food allergies, but more food sensitivities. How a lot of people, where you just take people off one or two foods and a lot of pain, or like I said, diarrhea, constipation, bloating, things like that go away that they've had for years and years. It can be very simple. And the other thing I would say sometimes is getting people off the wrong supplementation. If they're on poor quality supplements, or they're on the wrong supplement that their body just doesn't need right now, or one's filled with different fillers like mag stearates and things like that, I've seen those cause diarrhea and others GI issues, and just literally taking them off their bad supplements has done the difference.
So we're going to divide microbes into different categories. Like, let's take different parasites, and there's thousands of different types, running from teeny little one-celled parasites to 10-foot long tapeworms. Sometimes people can get them from contaminated water. A lot of times it could be foodborne, and the foodborne might be, it could be pork, it could be lettuce. It's hard to say. It's not always in the animal category. Sometimes it's from the food handler. Maybe if you're going to a restaurant, the food handler in the back might, not use proper hygienic methods, and they could impart their own microbes onto the food. Since we're a much more international society now, we're exposed to a lot of parasites that we wouldn't have been in the past. Again, just because we're exposed to lots of people from all over the world, which was much rarer if you go back 100 years. So, and also there's resistance. Two people could eat the same contaminated food or drink the same contaminated water, and one of them might have a very severe symptom picture from it, and the other one might be asymptomatic. So a lot depends on gut integrity. Do they have increased intestinal permeability? Do they have a tendency toward inflammatory reactions, or having overly respondent sensitivity reactions? So sometimes a lot of background issues, which we won't get into today, could determine how severe the reaction is to a particular microbe.
And if you look at a lot of, you mentioned parasites is one, if you think a lot of fish contamination, you can get parasites. And then if you look at traditional cultures, a lot of the times they would innately add in certain foods to their diet. When they would eat it, they might have an anti-parasitic when you're eating something that's a little more prone. So take sushi. One of the more common things that you get with sushi is wasabi. Unfortunately, the wasabi that typically you get in the US and abroad is kind of horseradish-ish with sugar and cornstarch and green dye added in, so it really doesn't do the trick. But real wasabi is a great anti-parasitic. Ginger also has some anti-parasitic properties, so sometimes those are built in.
Lemongrass is a good anti-parasitic at times, and that's built into more Vietnamese foods and so forth. Even some of the hot peppers that they use in different parts of the world. But parasites, when we lived back on the East Coast, I remember when people were hunting all of the venison, my hunter friends were telling me about, they'd find worms inside when they cut them open. So, it can be in a lot of things. Sometimes, again, if you live in an older house, that has a buildup of material inside the water pipe, sometimes they'll have it there, and when you turn on the water, the water will flush some out into what you're going to drink or what you're going to bathe in. You can also sexually pass about any organism, be it parasitic, fungal, bacterial, viral. So, sometimes that can be it. And one of the people could be asymptomatic. So you might have relations with someone who feels fine, but they might impart a microbe to you that you're not going to do well with. So there's lots of different possibilities. Definitely the healthier you are, the more whole food diet you eat, the more exercise, sun, good sleep, etc., you'll have more immunity than you would have if you didn't do those things.
And for people that have parasites, there can be definitely the risk of re-exposure, depending on if you have in your water pipes, or maybe your dog that licks you has ones, or things like that. But generally, helping someone deal with parasites doesn't have to be that difficult. Just like we mentioned with wasabi, there's a lot of great anti-parasitic herbs in nature that really work well. And one of our favorites, I would say more broad spectrum, is Malia, which is neem leaf. We have that my dad has it growing at his house, and it's a really great broad spectrum antimicrobial with a lot of good properties. It's great antifungal, it's great antibacterial, it's also a really good anti-parasitic. There's some other great anti-parasitics out there that we use a lot. Mimosa pudica is a very common one that you hear about nowadays, and it's interesting, the seed, it has this very gelatinous nature, and so it does have anti-parasitic properties in and of itself from the different chemical components, but when the seed mixes in water, it turns into this almost like mucus-looking gel, and they say it helps scrub the intestines as you go through and almost suffocate different parasites living in there. You also have Vedanga. Vedanga is one of my favorite herbs, and a lot of the research shows it works really well for more helminth type infections, so your longer worms, but Vedanga is another great anti-parasitic. Another one my dad's been using, he's Artemisia, which you've been using for decades.
Right, Artemisia annua, sweet wormwood, is a great one. They use it for anything from malaria to all different types of worms and so forth.
That was one we recently gave to a patient along with Malia, and they just started pooping out lots and lots of worms.
Yeah, sometimes the combination of Vedanga and Mimosa I like also. But if you're not going to actually be treating a patient in person and doing some type of testing to figure out what they need, if I just had to guess on someone, long distance, I would probably put them on a combination of Mimosa and Vedanga, or possibly, try Artemisia. It's a little hard. It could be a little bit hit and miss. One thing to know, though, is antiparasitics, they're not the best to take prophylactically necessarily. If you take them when you don't need them, they could cause some GI upset. So you might have a little trial and error before you find the right one. It's typically not good to put the people on a parasite cleanse that has 10 or 20 different herbs mixed in for that reason, that it typically will upset them just because some of the herbs they don't need.
And that's why we like to generally do single herb products, because then you can figure out which ones you specifically respond well to, and then take 1 or 2 or even 3 of those and not take the other 15 or 20 ingredients that are in a lot of the combos. So you're only getting exactly what you need, not the bad stuff that'll cause inflammation in your body, but you're also getting a high enough dose for it to be therapeutic and help in a short amount of time.
One thing that's not one of our products, if it's for your child, who's pretty young and doesn't swallow pills, sometimes black walnut glycerite will do a good job for them. So that's something to be aware of too. And again, like Noah originally said, it's good to try to seek out where they're getting their exposure. It's just something they just got on a trip when they went somewhere. If it's in your water, if it's in a food you're eating all the time, unless you figure that out, it's either going to keep recurring or it might not resolve in the first place. But typically, it's not that hard to treat. We haven't found the need to treat during different phases of the moon. We haven't found, that we've had to worry that much about, eggs hatching so many weeks later. That, when we've done it, a lot of the products, also will take care of the eggs and other things. We haven't had major issues with recurrence, except for, some people who are, maybe genetically more prone. We might have to treat them a little bit more frequently for things. And again, the symptoms could be anything. A lot of times you have GI pain, you could have diarrhea, you could have constipation from it, you could have Crohn's disease as part of it, you could have, just about anything.
And you got to look, one thing we talk about a lot and we definitely stress in a lot of our patients is avoiding foods that you're sensitive to. So if you are eating a lot of foods that you are sensitive to, your body's going to produce a lot of histamine, inflammatory, and then your body's going to use zinc up to break down histamine. And if you're using up all your zinc, then you're not going to have proper stomach acid. And if you don't have proper stomach acid, you're going to be more prone to get more parasites.
And histamine will also deplete your folic acid and your pyridoxal 5-phosphate. And there are other pro-inflammatory prostaglandins and leukotrienes that can be consequences of eating the wrong food.
And then if you add in chemicals and things like that, like let's take glyphosate, which is one of the main components in Roundup, that can disrupt your tight junctions in the intestines, and that'll give you more intestinal permeability, so things can actually pass through the intestines. Again, some of us have our own methods of testing for food. Sometimes you might have to try an elimination diet, and if things clear, introduce things one at a time. And sometimes it's something really oddball. Maybe the person is having problems because they're sensitive to Brussels sprouts or something. It's not always the gluten, dairy, type foods. But it typically, those are involved, but it could be some really oddball food. I've seen people reactive to bananas or reactive. I once in my past had loose bowels for months, and it took me a long time to figure out it was apples. So sometimes it's something you're not expecting. I had a friend once, acid reflux is something that you see quite often, and a friend of mine, he thought he was having a heart attack, went into urgent care, and he actually got diagnosed with a peptic ulcer. And I saw him, and I ended up giving him Morinda to take, noni, and that got rid of, he'd have this going on for a very long period of time, and within a couple days, all of his symptoms were gone. Golden thread, which is probably our most commonly used herb for H. pylori, can really help, but sometimes Morinda or the other herbs can also be beneficial for the person.
And since we're kind of skipping all over the place, with H. pylori, a lot of times you can get reinfected or even initially infected from poultry, including eggs, unless you really wash the surfaces they've touched, cook it well, wash your hands really well. A lot of the poultry in the United States is infected. I had a patient on Kauai who had many, many years of chronic GI, and he was a chicken farmer. And as soon as he developed more hygienic practices and we treated him, it went away and it didn't come back.
When it comes to diarrhea, definitely, foods, parasites, bacteria, those definitely different viruses, those can all give you diarrhea, but I definitely see food sensitivities really common. Sometimes nightshades can be really common cause of diarrhea. Other times you can have caffeine or gluten. Sometimes dairy, not as much, but definitely those are very common cause of diarrhea that I see. I've had people, having to use the bathroom 7-8 times a day, and I took them off potatoes, and then all their diarrhea went away. So when I think diarrhea, there definitely is microbial components a lot, but foods are some of the biggest factors.
Yeah, I've seen definitely parasites a lot with that too. And on the other end, with constipation, It can also be microbes, it can also be foods. I mean, dairy is probably the biggest constipator for a lot of people, especially children, who aren't going to the bathroom. A lot of times dairy is involved. It can be really a simple thing like a magnesium deficiency. Sometimes just prescribing the right form of magnesium. There are many different forms. There's citrate, citramate, glycinate, carbonate, and sometimes you have to play around. I mean, citrate's usually the preferred form for someone who's constipated, but it might not be for you particularly. There might be another form that works a little bit better.
We've definitely had patients that have had constipation for 20 plus years, and they said they've taken good quality magnesiums for years and it never helped, and I put them on a different type, like my dad mentioned, and all gone within a couple days.
People who are burping a lot, it can just be, again, it could be a food, it could be that they have a subclinical hiatal hernia, which those of us that are practitioners, know techniques to manually correct. That could be very useful. If they're bloating a lot, it could be foods, it could be fungus. Fungus is a big cause of bloating because of the fermentation that it causes in your gut. It seems more popular these days to eat a lot of fermented foods, which can cause some bloating because of the histamine release. A lot of people are drinking kombucha, which they're putting living fungi into their gut, and if they have a lack of adequate hydrochloric acid or some other things, it can basically colonize in your gut, and it can cause bloating. Our favorite antifungals are, again, Malia. Scutellaria is a great antifungal. Morinda sometimes, Malia. There's a lot of different ones that you could try that will do a good job. Mm-hmm. And you could get the fungus from it being in a moldy house, or again, it could be sexually transmitted. There are lots of different ways to get it, but if it gets into your GI tract, you might have bloating, you might have anal itching, you might have, like babies can get diaper rash, from fungus. Lots of various symptoms. It's very common these days to get.
I mean, generally though, food sensitive, or sorry, I shouldn't say food sensitivities, GI issues as a whole, people do really well if you can identify any type of imbalance in the microbiome and help it, as well as taking away any food sensitivities. People do great. One thing just to throw in, since we are jumping around a little bit, with celiac. One thing I've definitely found with celiac is I've had a lot of people that are diagnosed with celiac, definitely can't handle gluten, and they still come in with a lot of GI issues, even if, there's contamination, but even if, according to them, they're 100% strict. One common thing I find in a lot of those people is oats. And if, since all oats are gluten-free, the difference between gluten-free oats and non-gluten-free oats is the machinery that they're run on. Is there any possibility of cross-contamination? But all oats contain a prolamine called adenine, which it basically cross-reacts with gliadin receptors, and even though it is not gluten or gliadin, it can stimulate those same receptors and cause the same inflammatory issue. So I've had a lot of people that are celiac, and then I take them off gluten-free oats, and then their GI issues go away, which is pretty amazing.
And also with people with celiac, it's not unusual to have many other sensitivities, even above and beyond oats. They might be sensitive to corn, they might be sensitive to sorghum. A lot of the gluten-free products are pretty refined. They have potato starch and all kinds of other concentrated, refined things that could cause a whole lot of inflammation too. So we caution you with going crazy on gluten-free products. There are some that are more whole and better, but a lot of them are not.
I know Crohn's patients you've always had good success with in the past.
Yeah, usually in Crohn's patients, we do find parasitic involvement, fungal involvement, and food involvement. And again, we always try to look at as many different variables as we can. If we were just to look for parasites and not look for other things, there's a lot less chance that they're going to do optimally. So it's good to, look at it all. Those of you that do applied kinesiology, there might be things, like an ileocecal valve or something like that, not controlling, just being a part of it. And also with food sensitivities, they are a cause, but they're also secondary in a sense. So food sensitivity might be due to increased intestinal permeability or leaky gut. And so, okay, I'm stopping eating gluten, I'm eating rice every day. So suddenly in a month they can't eat rice. It can change a lot. So, some of these people, you really have to, if they're doing well and suddenly they're not doing well, it could be that they developed a new sensitivity. Could be, as Noah said earlier, they're taking the wrong supplement, or it could be that they've been on a supplement longer than they need to be. Any herb that's strong enough to kill a parasite or a fungus or something like that, you shouldn't be on indefinitely for most of them, because they will cause upset. So I usually tell patients, if they're doing great and suddenly they crash, so many weeks down the road, maybe stop everything they're taking for a day or two, and if they clear, put one back in each day, and then see if anything causes it to flare, because sometimes, again, they've just reached their tolerance level and they just don't need it anymore.
I mean, one thing somewhat related is, there's not one diet that's great for everyone. We personally have put people on anything from carnivore to vegan, and literally everything in between. I mean, I think, all of the diets have some of the same basic principles of avoiding sugar, of avoiding refined junk, a lot of the chemicals and stuff that shouldn't be even part of our food in the first place. But past that, I mean, depending on you and the time of your life, your exercise, your stress, all those different types of things, your diet may change. At certain times you may do better eating more meat. At other times in your life you may do better eating less meat, and everything in between. So that's just one thing to consider of, there's not one diet. Just because a diet worked for someone else doesn't mean it's going to be working for you. And just because something worked for you at one point doesn't mean it's still good for you now. It can vary, and that takes, seeing someone who does applied kinesiology can help hone that in for you. But it does take some trial and error also to figure out how you personally best respond.
I mean, for those of you that are applied kinesiologists listening to this, if you didn't come to our talk at ICAK or one of the recent seminars, we've developed some methods to try to figure out the best diet for a particular individual at that particular time. Mm-hmm. And we can share it if needed. Anything else you want to cover?
No, I mean, like I said, GI issues do great if you really address the gut microbiome. That's so big, and then also taking people off foods that they're sensitive to, those two things, and you'll clear up a lot of other issues also just by fixing the gut. So many other health issues will just go away by addressing these factors.
It's one of the things that we typically see results between 1 to 3 visits. If we don't, we're very surprised. It's a very small minority that we don't see good results that quickly. Mm-hmm. Just a couple of things in closing. If you don't get my monthly newsletter, it's free. It gives some case histories, talks about new products. You can just shoot me an email at noach2343@aol.com. We'd be happy to put you on the list. We do have our seminar video that goes into actual testing techniques for the things we covered. Also, we are teaching at various times. If you go to my website, michaellebowitzdc.com, any upcoming seminars will be mentioned. And if you have any topics you'd like us to cover, if we feel like we could do a good job with it, we'd be happy to include them in our monthly talks.
And also make sure to subscribe to our YouTube channel. We have a lot of other videos, some very product-specific videos, and then others more about topics from fungal issues, fatigue, biochemical joint pain, GI issues now. And subscribe and just check out our other videos to learn more about our products and the work that we do.
Thank you very much. Aloha.
Audio quality might have been bad.